All right. Good afternoon. We are here now for our 5 p.m. daily coronavirus update. Let me say to everybody out there, we're going to get through this. I know that the days are already starting to get long, and I know your patience can get short. But this is the challenge that we are facing in our lifetime. It is one that we are up for. It is one that we will win. But it takes all of us every day doing everything we can, being committed to being a good Kentuckian, a patriotic American, and following the guidelines that are out there. The steps we are taking, we have never seen and we have never felt in our lifetimes, but they are absolutely necessary to making sure that we protect the loved ones around us. And we have sacrificed. I understand that so many businesses have closed and that we are going to have to make more sacrifices. Our kids aren't in school getting that direct instruction that they need. So make sure that you are not the person out there that is frustrating our attempts by trying to get around the rules, by trying to claim that you are the exception or should be the exemption. This is all of us, every day, working together to make sure that we defeat this coronavirus. Want to start by the good news that's out there. All those good things that you all are doing to model the types of positive behavior that we need to see that's out there. So I have James Hatchett, who's helping me here today. He's behind the computer. Let's put up some of the social media that we have seen. I love this one. This is one of our kiddos who, of course, is not in school right now, who is thanking all of the doctors, nurses, and everyone else who is showing up to help us. Know that while we have to shrink our contacts, our medical personnel might not be hearing from people about the heroes they are. You are, and this ought to remind you of that. We go to the next one. I think this one's pretty special. It shows the bond that our students have with their teachers, and it shows how our teachers are stepping up even at a time when they can't be in that direct classroom to make sure that our kids are still getting the instruction that they need. We have really special people in Kentucky. Again, these are folks delivering food across our communities. We are there for each other. We are good neighbors. We're going to make sure that everybody has enough. And the way that we do that through this epidemic is to make sure we're delivering food, but also know that there is going to be enough, that our food supply chain is going to be there for us. We go to the next. So this is requiring all of us to adapt, to do things differently. And we have more modern technology that allows us to interact with each other than ever before in our history. I know this seems tough, but think what it would be if we didn't have all of the different forms of technology that can keep us together even when we have to be apart. And I need you to innovate. As we have to take more and more steps, I need you to innovate, because so much of how we feel is based on our interactions with each other. And I need you to keep having them just remotely and virtually, digitally, on the phone. Those bonds that keep us together are what's going to keep us going to follow these rules and restrictions that we've had to put into place. So yes, communicate, just don't do it in person. Make sure we have that social distancing. Be creative. Go to the next. Well, we have to show a dog picture or two. Let's go to the next. I love this. I love seeing our kids and how they adapt. Our kids are so resilient. I mean, I remember when my son was 2, he was actually with one of his sets of grandparents. I wasn't out there yet, and he fell and he broke his wrist. And I started thinking, how does a 2-year-old deal with that? He didn't take 1 minute off. He figured out how to do everything with his other hand and his other arm. That kid didn't feel sorry for himself for a second. The resiliency that our kids show us about how they're going to get through this should help us be just as resilient, be just as committed, to realize that we're going to be okay because we're going to come together and do the right things. So this is the model laboratory school. We're asking people to model the types of behavior that we need to see to fill our social media with the type of steps we need them to take. I appreciate modeling that behavior. And I appreciate this one too. Making sure that those who right now can't get outside, can't have visitors, these are people taking care of the grounds and trying to do everything they can for those in our nursing homes and our senior care centers. All right, and those are just some of the examples of what Kentuckians are doing to model kindness, and I want to do that right now. So just about every time I've been up here, we've had Virginia. She's been here by my side, helping to make sure everybody's included. And we'll have Rachel, who will be here in a minute, to help them out. And it's my fault that I've not introduced Virginia since we've been doing this. But today, in a little act of kindness that's easy for me to do, we are making both her and Rachel Kentucky Colonels for everything that they are doing to help us through this. So this is Virginia Morse, who is standing right next to me. Just a little something to show how much we appreciate her and what she is doing. So with that, we will move into our update for today. We do have more cases, and we ought to expect to have more cases each and every day. That's what we're going to see as we move forward. If you will, James, put up our St. Louis and Philadelphia graph. So as we talk about all the steps that we are taking, we are talking about what we do to limit our contacts, to make sure we have enough capacity in our healthcare system to protect those that are going to be the sickest as we see an increase in cases. And we are doing everything we can to decrease those contacts, and most all Kentuckians are out there doing it with us. But even when you look at St. Louis, you see that there is that increase in cases in that example, just like we're going to have here. So this is the natural thing that we expect is going to happen as we deal with this. And as we mentioned yesterday, we have more and more testing labs coming online every day, and they have different capacity, and many of them are outside of Kentucky, so the amount of tests that we get in Kentucky can change. But we believe, as we are here tonight, that we currently have 63 positive cases in Kentucky. Now that number will change, and we have to await labs confirming those numbers with us as they come in. I believe the new ones that we have as a change from yesterday at 5 are a female in Henderson, a 17-year-old female in Jefferson, a female in Warren, a 48-year-old female in Pulaski, a 28-year-old male in Callaway, a 79-year-old female Jefferson, 34-year-old male Fayette, 67-year-old male Fayette, 55-year-old female Fayette, and the rest are in Jefferson. We don't have all those demographics yet. At least 8 females and 4 males. But this is, again, what we expect to see. We're ready for it. We're going to make it through it. And people are going to test positive as we go. And there are people that we're going to know. And let me just take a break here to mention that we have to treat folks that come down with the coronavirus with compassion. And we've already seen instances out there where there's enough information to identify somebody, where we've seen people reacting in a way that those folks don't deserve. That we've got to understand that people are going to get this, and a number of people are going to get this. And there was a story, I think, today in one of our newspapers about a person they think is the very first person who got it because they were going to California. Folks, we can't blame anyone that comes down with the coronavirus. No one is the one individual spreading things. Treat everybody out there with compassion, especially folks that are going through this, that have had it, and that have to live with that uncertainty while they do, that have to be in that self-isolation. When we find out somebody has come down with the coronavirus, it ought to bring out the very best in us, not the very worst in us. It's the time when they need us the most. So let's agree. Let's come together. No more blaming. Even if somebody over the last week brought together a crowd when they shouldn't have, even if we find that, and we are finding that something spread during that, people have made mistakes. We are all committed moving forward. Let's make sure we react in the positive way that brings us together as a people and not pits us against each other. I've talked about this being a test of the type of people we are and a test of the type of neighbors that we truly are. And here in Kentucky, I believe we're going to pass that test. But we got to keep reminding ourselves that at that moment where we start to panic or where we have anxiety, we got to come back together. We got to make sure that we keep a clear head and we got to move forward. I know that's not easy. There are moments that I feel overwhelmed too, no question. I try to take a walk. I get those dogs out. I do something with my kids. And that type of mental health is something really important. So at the very end of this, starting at about 5:55, we've got about a 10-minute video on especially mental health for our kids and for our parents that'll hopefully help us just to be able to talk about this in the best way possible. And then we're going to post that video on our website. So I'm going to try to do things a little bit faster today. I'm going to start with new steps that we are taking. There are a couple of them here today, and there will always be some additional steps. The first is that we have asked our superintendents to continue to cease their in-person classes until at least April 20th. That adds a couple weeks on what we had previously asked, but again, it's necessary, and we believe it's better to let you, parents, and others know ahead of time that we're going to need to extend this. Let's put back up St. Louis and Philadelphia. I want you to look at this graph, especially where we see St. Louis. You see that second bump? That second bump is not sticking with the practices that were needed for long enough to defeat it the very first time. What we have to do is to be committed to reducing our contacts, on making sure that we don't spread this virus for long enough to win the very first time. And folks, that's going to be hard because what we're seeing right now is an increase of cases. You see that on both of the graphs, and that's going to happen. But it's also going to be a test of our resolve when we start seeing decreased cases. It'll be because we're decreasing our contacts. And we're going to have to be strong. We're going to have to stick with it and understand that if we're going to beat this the first time, there's going to be a period where we're going to have these restrictions, even though we're not seeing the same number of positive tests. Number two, the tax deadline. Since the feds were nice enough to move it on their end, we're happy to oblige. So as far as Kentucky goes, we are moving it along with the federal government to July the 15th. Third, want to thank a couple folks. Our bourbon distillers are now actively helping us to create hand sanitizer. They are doing their part to try to help increase the supply that's out there, and we thank them for it. We've also put out a call to Kentuckians all over to help us collect industrial-grade respirators. Those are going to help us, especially as we want to move towards the type of mobile testing where we hope in the future everybody can get a test when they want it. And the Chamber of Commerce put out a call. Many have responded. Toyota, I believe, is donating over 1,000 of these respirators. We need more. That's part of this PPE you continue to hear about. That's the personal protective equipment. The more we have, the more that we can do. And the more that we have, the faster we'll be able to get towards the large-scale testing that we want. Those are the new announcements that we have today. I'm not going to go over today. I'll give everybody a break. The previous steps that we've taken, I will just say it's incredibly important that we follow the guidance. There's, at this point, no place in Kentucky where we ought to have crowds. We're not trying to put a number on it because any group of people that is close together can spread this coronavirus. These are all social gatherings, all of them. We've had to close restaurants and bars. There should not be exceptions. We can do takeout, we can do curbside, and if we model good behavior, we can do pickup. We have also had to take other steps that apply to any forward-facing business, and I anticipate that we will have to take other steps as we move forward. Just remember, this is our patriotic duty, and where we see that patriotic duty tested are tough areas. For instance, we have seen virtually all funeral homes come together and tell families something really tough. And because of this, we got to limit even funerals to a small group of people. Yet, there are a couple out there, and I'm not going to name a county tonight because I expect them to change before tomorrow, that are holding very large ones when we know what that can do is spread the virus and will spread the virus amongst the people that are there. I know it's a hard ask. All of these are hard asks, but this is our challenge. A challenge like none that we have seen in our generation, and we have to step up and we have to do what it takes. Remember, if you are the one business, the one group, no matter what it is, that is creating these large gatherings, what you are doing is helping to spread the virus. And if you are a business that 2 weeks into this is just now taking your very first steps towards social distancing, then you have not been doing your part. Again, we will have to take more aggressive steps if everybody out there doesn't conform with this guidance. And think about your workforce. Those are my people. We are going to do everything we can to protect them. Right now, it's not about anybody's bottom line. It's not about anybody's party. It is just us as Americans versus this coronavirus. And we got to believe that. And we've got to internalize it. And we've got to realize that we are our brother and sister's keeper, and every single one of us has to do our part, and we cannot be the person that frustrates that, because what it does is does not recognize the sacrifice that so many are making. All right, we're going to move into our questions because I want to make sure that we have plenty of time to show this video. One question that I have is, can we give an update on unemployment claims? Let me do this real quick. During this time, unprecedented time, there is no stigma for public assistance. We want everybody who qualifies on it. And we are working every day, especially for you independent contractors and others that might not qualify for unemployment, to do everything we can to open that up. And I hope that we will have news on that next week. But I want to put up the how to file for unemployment and the schedule that we have. As James is working on pulling that up, an important announcement on this is if you started your application this week for unemployment, you need to finish it by tomorrow night, Saturday night at 11:59. If you started your application this week, and those in the media, if you will push this out, we want anybody who started it not to have to restart it. We're already in times that can create anxiety. We don't want to create extra hurdles for people. So if you started your application this week, please finish it by 11:59 on Saturday. Next week, we need your help in following the schedule to make sure that we can process everybody's claims in a timely manner. So based on your last name, which you have seen, there are different days for you to sign up. There is no penalty for waiting for your day. We will make sure you are credited at the right date. People want to know how many claims are being filed. The Federal Department of Labor has asked us not to give a number, so I won't. I'll just say that last year we had, at this time, 1,957 claims, and this year we have 8 times that at this point in time. That's giving you an answer while still abiding by what they asked. Yes?
Where are we on testing today? I know you're in constant contact with the White House.
So, well, let me talk first about where we are in Kentucky. The good thing is we have more labs that are coming online every day. It is increasing the capacity. It's hard even for us to know because most of the labs aren't here exactly what portion of that capacity on any day is available to us. We are seeing significantly more tests each day than we've seen in the other days. We know that there are, I think, have been well in excess of 1,000 tests thus far. Know that because of that, and they're being done in so many different outside groups as they grow, it's going to be harder for us to track it. So, for instance, our map on the website does not include negatives from those outside labs. All that information on numbers is going to be a little imperfect as we go, but folks, that's going to be a really good thing if it means that we have that increased capacity. If you will put up the website, we want to make sure that we remind people that this is the source to get information on the coronavirus in Kentucky. That's kycovid19.ky.gov. We continue to hear wild rumors out there. That happens at times of uncertainty. No, the National Guard is not coming out to encircle your neighborhood or your community. No. When and if we use the National Guard, it's going to be to help people. It's going to be to help our medical facilities. It's going to be to help distributing things. That's what the National Guard is going to do when they are called upon in Kentucky, and they're already helping us in a couple of ways. Let me also point out our hotline, 1-800-722-5725. Remember, if you are feeling well, but you're just nervous, right now, we need you to be strong. We need you to know that 80% of people who get this are going to be asymptomatic, aren't going to be harmed at all. We need to make sure this hotline is reserved for people who are sick but might not have otherwise sought care. We want them to call us or to call their doctor before going to a medical facility. We don't want to flood our healthcare facilities. And then last, someone who is truly sick and would have sought care or is injured ought to go ahead and seek care. I got a question on how soon does, it says LabCorp, expect to see drive-through testing in Kentucky. The answer is we are going to get it up as soon as we can. The limiting factors that are out there that we've got to address, and we're working for it every day, are we need the number of kits to do it. And again, we see more kits out there each day. We need enough swabs to make sure that we've got to swab everybody that comes through. And then we need the personal protective equipment to make sure the people who are conducting the tests can do it as safely as they can. Those are, some people call them masks or respirators. Those are the clothing called the gowns. Those are gloves. Those are goggles or face shields. And so I will say anybody out there that has this equipment, we will absolutely take it. There is not just a shortage here in Kentucky, there is a major shortage nationally. And we're doing everything we can to get enough so that that is not a limited factor in setting up this drive-through testing. I'm working every day, and we got the planning to get it up as soon as possible once we can address the things that we need to make it happen. But please know, we're working each and every day to get to the point where anybody who wants a test can get a test no matter what. But we're not there yet. So our Test to Being Good Neighbors continues. We got to make sure that they are available for the sickest amongst us. Yes?
Someone called the newsroom earlier asking if there's a plan for an unemployment extension for those who have either exhausted their benefits or their benefits are almost exhausted. Is there a plan for that?
So the question is about people whose unemployment has been exhausted or is almost exhausted, and I see Josh Benton, who is spearheading that for us, coming up.
Thank you, Governor, and thanks for the question. So we have to have, the federal government has to allow us to request that extension. I know right now with the expectation that unemployment rates will be volatile over the next few weeks, we anticipate that that option will be made available. It's also being discussed in legislation that's being proposed that's going to follow on coronavirus stimulus opportunities. So we think that's going to be an option in the future. When it is, we will absolutely apply for it. Thank you.
Let me just add that I'm going to do everything I can to make that happen. I mean, those who have been unemployed with the coronavirus that's here now are going to have the hardest time ever to get reemployed. So I'm going to push the federal government, and certainly on our side, the moment we can do it, we're going to do it, These are our people. We want to help everybody get through this time. Thank you for that question. Morgan.
There's been a report that dozens of people in Pulaski and Callaway counties have gone into self-quarantine due to potential exposure at church services. Are you aware of that or of any similar cases like that in Kentucky?
The question is about whether is have I gotten reports of dozens of people in Pulaski and Callaway County going into self-quarantine based on potential exposure, one at least at a church service. So I have seen a Facebook post from a church in Callaway County that chose to hold services this last Sunday. Folks, as a person of deep faith, I did not want to have to recommend that we not do church services. But understand when I make these recommendations, it is about the health and the safety of all of our people. Whether you hold church service isn't a test of your faith. God gives us wisdom, and we need to follow it. And as you all know, this weekend, there are going to be no social gatherings at all, and that includes those services. We do believe we have seen the spread in church services, and right now we have to do what it takes. Now, we do want all of our houses of worship, all of them, to find alternative ways to provide that service to your people, to your congregations. Whether it is virtually, whether you can call your local radio station, whether it's through local access, please continue to reach your congregation in new and different ways. It's something that we need more now than ever, both for me, Sunday is what helps me get ready for the rest of the week, and I certainly need that right now. It's about our sense of belonging and our sense of connectedness. And remember, our houses of worship do so many other things. So if you are preparing meals and delivering them, keep it up. If you are getting, if you can reach out to your congregation and find more of this personal protective equipment that we need, keep it up. Keep doing those good things. Just don't get folks together in a crowd, which is what we are trying to avoid. I think I answered this question about data and maps online. There's a question here. Are golf courses impacted by our order? Here's what golf courses need to do. They need to shut down any area that people would come into where they could congregate. That is a forward-facing type of activity. At this point, I would recommend that they discontinue the use of golf carts because those are things that the surfaces have different people on. But if your course is there and people can stay 8 feet apart outside and are diligent about doing it, that provides an activity that people can get outside and do. Don't abuse it. Make sure you follow the guidance. Again, the last thing I want to do is put out more restrictions that are out there. Do we as taxpayers have a way to refuse our Kentucky state tax refunds? That's an incredible question. It's about knowing that they can donate to charity, but can they allow us to keep it for our efforts to fight the coronavirus? That's really incredible. Let me get the answer to that.
A viewer who contacted us works at a manufacturing plant. He has chosen to self-quarantine because he has COPD and other underlying health conditions and just worried about actually being in such a large facility. He said that his employer had agreed to grant him short-term disability, but only if he could provide documentation from a health department saying he was self-quarantining for those reasons. He seems to be getting an end around from the health department and his employer. Have you heard concerns similar to that?
So this is a question about someone who works for a manufacturer who has some of the conditions that would make you most vulnerable. I think this one is COPD, which is heart. And remember, those over 60, and those that have heart, lung, and kidney disease are most vulnerable, though we're seeing lots of other people get it. Just because you're not in that group, you are not indestructible. And even if you would be asymptomatic, meaning you might not even have a runny nose, that you could potentially spread it to other people. So remember your duties that are there. According to the question, this individual has chosen to self-quarantine, and his employer has said that his benefits will depend on whether he can get a certification from the local health department. Don't do that, employers. Don't. If you have somebody especially that falls into this high-risk area, put the health of your people first. Again, we'll work to make sure we've covered that individual, but let's make sure that we are better than this. That person works for you. That person is a Kentuckian. If that person is at high risk, they should absolutely not be in an area where they would have the extra ability to be exposed. Next question. Do you hope to see fewer restrictions on getting tested for the virus? Yes. And the moment that we have the capacity, you will see fewer and fewer. Now, I will say, as all these labs have come up online, the decisions on who's getting tested are no longer being made by our Department of Public Health. They are being made by the practitioners in consultation potentially with those labs. But again, while that spreads out that decision making, every day that there's more testing capacity is a good day. But just remember, something we've never dealt with before. And so every new good is going to have a little bad. And just like every new fact that we get, it might make us breathe a little bit, probably has a little bit of good in it too. That's going to help us better respond to the virus. We've been trying to learn about the U of L lab the governor's referring to over the last few days. We are speaking directly to folks at U of L. My information, it's the University of Louisville that runs the lab. I think they're having a press conference here soon. Is the state health department tracking personal protective equipment and bed capacity across the state and all our healthcare facilities? How bad is the shortage for these? How bad could it become? Let me start with the second part. There is a shortage of personal protective equipment, and it's all over the country. It is everywhere. And all of us are doing everything we can to find as much of it as possible. And that's why these healthcare providers, our frontline healthcare workers, are so incredible. They know that there is a shortage, and yet they still go to work every single day to help the sickest amongst us. Right now, we do have enough beds in this state, and the reason that we've called for all elective procedures to end, they should have already ended. And folks, if you are a facility out there trying to find an exception, please do not be that type of facility. This is a moment of American patriotism where we are going to need your capacity. I want to thank a number of people who have sent in that they have not only stopped their elective procedures, but they have sent their dentists and optometrists and ophthalmologists to the local health departments and hospitals and said, we are ready to help when called upon. That is the type of patriotism that we need right now. Yes?
We've been getting some calls to our newsroom, people maybe working at a manufacturing company or someplace or there's people gathered, maybe not abiding by certain guidelines. Can you take action against them? Are there guidelines? Are you inspecting companies for that?
The question is on manufacturing facilities that may not be following the CDC guidelines or our requirements out there. We're going to work over the weekend to create a number that people can call in directly to report these concerns. Again, we are trying to take escalating steps to ensure that we are reducing contacts. We have been working all week on individual calls that have come in, trying to get people to respond and do the right thing. At this point, we need a more central way that people can call if they are concerned. Don't call the coronavirus hotline. We'll have an update on that. But again, to our employers out there, your employees are a lot more important than anything else. They are people. They are Kentuckians. They are our friends and neighbors. They're my people. We need to make sure we're doing the right thing. And if you prove that you can't engage in the social distancing, that you can't change, whether it is your production line or anything else, and you are not providing what will ultimately be determined to be absolutely essential in this battle, you will force us to take action. Please be proactive. Please act now. Don't try to be the exception or the exemption. We'd like a rough number of how many unemployment requests have been filed this week and how that compares to a typical week. While the Department of Labor says we can't give you an actual number, I think we gave you a general idea. Do I have the power to change unemployment requirements to allow independent contractors to receive unemployment insurance? We are working on this very hard right now. I hope to have information for you next week. For now, we're awaiting the SBA to approve our application, and that would allow small businesses to apply there. We want you to sign up for Medicaid. Can we put up the Medicaid slide just so people out there can see it? At this time that we are dealing with a national health emergency, everybody ought to have health care coverage. If you qualify for Medicaid, sign up. We want you on it. We want to do everything we can to help protect every Kentucky citizen. What about unemployment extensions? We talked about that. We are hearing from constituents who have barriers to receiving Schedule II drugs they have been on for some time, and others who are not able to get a 30-day refill. Let us look at that. My executive order is intended to allow everybody to get the refill that they need, especially if it's a routine prescription, without having to go back to your healthcare facilities. We'll work on providing guidance on that from our Department of Health. Morgan.
Do substitute teachers qualify for unemployment benefits?
That's a good question. Do substitute teachers qualify for unemployment benefits? I see Josh coming back up. But I'm taking the water.
Yeah, it's all yours. Thanks for the question. That's something we're going to have to get clarity on. In the past, in a normal school year, substitute teachers have not requested unemployment insurance during the summer months. We have been talking to the Department of Education about how to clarify this issue for substitute teachers who are not able to work like they normally are during a school year. So we hope to have an answer next week.
Great. And I hope everybody out there knows that each and every day we're facing questions like this. It's a very good question because we've never seen anything like this before. So every one of those issues that pops up, we want to know about, we want to work on. Please have patience with us. We're doing the best we can, just like you are doing the best you can. And we're going to work as hard as we can for you every day, whether it's filing for unemployment or others. Understand that sometimes there's going to be wait times, and it's going to be hard. It's hard to have patience in a time of anxiety, but we're going to make it through, and we're going to be there for absolutely everybody. I'm going to work on any law that is preventing people from getting through this that at a different time might have made sense, but we are in a different world now. And we're going to be in a different world as we come out of this, but we have rebuilt before. We will do it again, and we will be stronger. We've received questions from Paducah and Northern Kentucky from Kentuckians concerned they cannot see the updates on local TV and concerned people are not getting the information they need. Is there anything the state can do? Well, I would ask the television stations in Paducah and Northern Kentucky to start carrying this. It's just a chance for us every day at 5 p.m. to get together. I know it helps in your routine. It helps in mine too. I mean, in these times, we need that schedule. We need to get together. We need to make sure that we are getting direct information out there from the source. And I hope you've seen when I don't have an answer, I'm going to admit it to you. But we're going to come back and we're going to make sure we get you the clarity that you need. We also appreciate you tuning in and sending us questions because it helps us know different areas that we need to address. We're all in this together. That includes us. That includes me. And we're going to continue to try to do better each and every day. That question seems like a plant, doesn't it? I'm working on a story about a local church holding a drive-in service in lieu of traditional Sunday services at a local drive-in movie theater and listen to the pastor deliver a sermon. I'm seeking clarification as to whether gatherings like this violate our action regarding public gatherings. I believe that this is a creative solution as long as there is the distancing between those cars. Again, we want to see creativity. We want to see ways that we can connect, but they have to make sure they follow that guidance. We can't be trying to get around it. We got to be trying to find new ways to do it. Dr. Stack, you want to add?
No, that's good.
Okay. My Commissioner of Public Health says that's good. All right. Voter ID legislation. Several outlets have asked whether I'll sign the voter ID law. Now, I will admit that I've been working on the coronavirus every day, all day long, and it's what, like you, many of you, keeps me from sleeping a lot of times. And when I do sleep, it's pretty much what I think about while I'm sleeping. I have not followed legislation as it's passed, and so I'm going to ask, if I can, people in here, would it apply to this upcoming election? Well, we're going to have to analyze the bill, but folks, think about the world we're living in right now. Our clerk's offices are closed. How somebody would go in and get an ID right now in the middle of a healthcare crisis and that be dependent on them voting, well, I think we all know that that's a little silly, and it's just not the world we're living in right now. I will tell you that if this is going to make it harder, especially for people to vote in this election with what we're going through right now, I definitely won't sign it. Now, I don't want that to be an attack on Michael Adams, our Secretary of State. He worked with me and, in fact, requested that we move our primary, and he's being very creative in what solutions we might have if we're still dealing with that during this period of time. In his dealings with me, he has not been partisan at all. He's just been a part of Team Kentucky. But I will say that, our world's changed since this bill was filed. It'd be nice if our General Assembly acted like the world had changed and not passed bills that would upset people. Right now we got people anxious and on edge. We know it. And we all have to make sure that we're staying calm and being a good neighbor. And when we see bills out there that would rile people up, we just shouldn't have them. We're just not there in our world right now. Yes?
Speaking of elections, looking ahead to November, if the CDC guidelines are still in place, would you support widespread mail-in voting?
The question is, as we move towards elections in, I think you said November, but can I switch it to June because we're not there yet? Would I support mail-in voting? If we're going to have an election in June, and if we are still dealing with this coronavirus, then if we are still making sure that we are decreasing our contacts, then that's something we will absolutely have to consider. And I'm proud of our Secretary of State for looking at those options. I will say this. I know our poll workers. I show up smiling too early during many elections, some of which I've been on the ballot. And as I think about the one that gives me, that I sign my name on and the ledger and gives me the ballot each year, that person is in a high-risk category for this coronavirus. I will not ask those folks to come in and work as poll workers if we are still dealing with this the way we are right now. Even when it comes to elections, I'm going to put the lives of our Kentuckians above everything else. We got time until we get there, but I want those that have worked it or those that would be nervous about going to vote because of the coronavirus to know that we are always going to put their health first. We'll take one last one, Morgan.
I went to a couple clinics today that have kind of taken it on their own initiative to set up sort of drive-up testing, working with a private lab. Is that something you're aware of, or something you'd encourage, I guess, for clinics to do if they can?
So we have seen, the question is, a couple of small drive-up testing clinics, and I don't have the full details on them, but here's what we know right now. We are working as fast as we can to try to get to the point where everybody can get a test through, and it will be most likely a state or city or county run drive-up testing facility. We're making the plans, and as soon as we have what we need, we will be ready to do it in less than 48 hours from when we know that we have the supplies to do it. Up until that point, if there is a facility that thinks they can do this, a couple of things are important. One, we still don't have unlimited capacity that is out there to test everyone who needs it. And so my hope is that we use the resources wisely and that those that come and get tested are ones that truly need to. Because in a world of limited capacity, if that is taking a kit away from somebody who might need it more, then that raises a concern. The second is understand that with all the folks that are nervous out there, we ought to make sure that we have sufficient capacity if we open something up to the public to truly allow the public to come. When we have a chance to do this, I don't want to turn people away. And when we have a chance to do it, I'm sure we'll have to do it regionally. It may start in one region before the other, and we're going to have to ask at that point for even more patience out of people, because everybody won't be able to come the first day, and everybody shouldn't show up in their cars and have to sit in a line for 8 hours. So we're going to have to do it whether it's by last name or something like that. And so, again, every time that we look in the future towards something we want, it's still going to require us to have real patience and to be really good people. I'll just close tonight because we want to start this video, and I'll introduce it here in a second by saying, as we look back in time, I'm not sure that our U.S. economy has been impacted or changed to the same degree we are seeing now, really since World War II. And at that time, the greatest generation, as we call them, stepped up both abroad and in the U.S. to do what it took to make sure that we were victorious and that we made sure that our people and people all over the world were safe. We are being called to change our lives, to protect those around us. And it's something that's going on all around the world. This is our test as a generation. This is our time to show that we put our neighbors and our country ahead of just a bottom line, that we don't look to be the exception, we look to be the volunteer. We look to be the person that will step up and do what it takes. You know, we had a letter that went out for volunteers among med students to help out in a certain area. That's the type of patriotism that we need to see. And there may be a point where we need our healthiest that are out there to help us in situations with those that need us the most. And we're going to call on you then too. But I know we can do it. Why? Because I look at all those school buses driving around our counties, delivering meals, even though they know that the coronavirus is out there. Why? Because they will even put themselves in harm's way to help that child that needs that meal. Remember, we have two adversaries in this. We have the coronavirus, and we have fear and anger and frustration and those emotions. And if we give in to those, more people will be harmed than will be by this coronavirus, even as it escalates. We cannot forget the vulnerable among us. We cannot forget that there are kids out there that need us. We cannot lose our humanity even when we have to distance ourselves from people who help us keep our humanity. This is a major test that I could have never imagined before we're here. But I know that we are ready for it. I believe in our people out there. So keep the faith. Make sure that you are taking care of yourself. Get exercise. Stay on a schedule. Do everything you have to do to preserve your mental health. I'm going through this personally just like you are. And just because I may be good right now standing up here doesn't mean I don't have my moments like we all do. Take care of yourself. Take a walk. Reach out and talk to the people you love. Do what it takes every day and understand that we are going to have to keep working through this. And even with uncertainty about when we're going to come out the other side, we are going to come out the other side. And if you follow the guidelines, and everybody else has too, we'll have protected those that have needed us the most, and we'll have passed the test, the biggest test of humanity in our generation. Thank you all very much. I'm going to leave your kernels right up here. Thank you. Now we're going to introduce the video that we will put up. Actually, let's wait about 60 seconds. This is good for kids. You might not have had them here for the press conference, but if you can bring them into the room, it's also good for parents. And so parents, if you still have a little bit more time, it's about a 10-minute video. You can watch it, even if your kids aren't there. Then we'll put it up on our website to make sure that you can share with them. It's about mental health, especially in kids that are showing anxiety, just like mine. And remember, I'm the dad of a 9 and a 10-year-old too. I watch them. I know they internalize this. We got to be there for them, but you know what? They're there for us too. Thanks.
Hello, kids, and I know some of you might be young adults. I'm Alan Brenzel. I'm a pediatrician and child psychiatrist, and I've been working with children, young adults, and their families for over 30 years. And I often talk to kids about their worries. And I want you to know that I understand how you might be feeling right now. All of us have gotten concerned about something that can make us sick. It's called COVID-19. It's caused a lot of things to change in your world. If you're in preschool, you're probably missing your teachers and your friends and the fun activities you used to do, such as building with blocks or painting or playing on the playground. Maybe your school had circle time. I'll bet you really miss that. Some of you might have been used to staying with other relatives or caretakers during the day, and now you're not getting to do that. You might be really missing them too. You might be wondering why you have to stay home every day. I want to talk to you about that later, but first I want you to know that it's normal to feel a little out of sorts right now. A lot of kids are feeling the same way. Things are going to be different for a while. One hard thing is that right now we just don't know how long things are going to be different. If you're in elementary or middle school, you might feel sad and be missing your friends, your teachers, and the routine of the school day. You might even feel a little mad. You might get restless as you try to figure out a new routine at home. We're going to talk about routines. You might be missing Hello, kids, and I know some of you might be young adults. I'm Alan Brenzel. I'm a pediatrician and child psychiatrist, and I've been working with children, young adults, and their families for over 30 years. And I often talk to kids about their worries. And I want you to know that I understand how you might be feeling right now. All of us have gotten concerned about something that can make us sick. It's called COVID-19. It's caused a lot of things to change in your world. If you're in preschool, you're probably missing your teachers and your friends and the fun activities you used to do, such as building with blocks or painting or playing on the playground. Maybe your school had circle time. I'll bet you really miss that. Some of you might have been used to staying with other relatives or caretakers during the day, and now you're not getting to do that. You might be really missing them too. You might be wondering why you have to stay home every day. I want to talk to you about that later, but first I want you to know that it's normal to feel a little out of sorts right now. A lot of kids are feeling the same way. Things are going to be different for a while. One hard thing is that right now we just don't know how long things are going to be different. If you're in elementary or middle school, you might feel sad and be missing your friends, your teachers, and the routine of the school day. You might even feel a little mad. You might get restless as you try to figure out a new routine at home. We're going to talk about routines. You might be missing the chance to play soccer or lacrosse or basketball or other group activities that you like. You might be feeling worried about the adults in your life. Have you noticed that some of them seem a little stressed right now? Even some are having to work from home or not able to work right now. Other students are feeling the same way you are feeling, and it's okay to feel sad or worried or even a little mad. If you're in high school, this is really creating a mess for you. You might feel very isolated, cut off from people you enjoy seeing each day. Some kids are telling me the one thing they're really mad about is that sleepovers are being canceled. The bad news is that is what we're recommending, so that's our fault, but that's what we need to be doing. We know that your friends are a really important part of your life, and even though you can text and talk from home and interact in other ways, it doesn't seem the same, does it? And some of you were probably playing sports or on teams and had your whole seasons canceled. That's really not fair, is it? Especially after all that practice. If maybe you were working on a spring play or a musical and now you're not going to get to do that. Wow, that's really hard news to hear since you worked so hard. If you're a senior, wow, you probably have some really big worries. Am I going to pass my classes? Am I going to get to graduate? Am I going to get to go to prom? Or am I even going to have a graduation? Those are really important and big worries for you right now. The problem is the answers aren't clear, and I know how frustrating that is. Each of you has many, many reasons to feel sad or worried. I just want you to know these feelings are normal. I get it. I do know that you're hearing a lot about coronavirus. It's also called COVID-19. And some of the information you hear from others or read online might sound really scary. But some of it doesn't apply to us here in the US or us in Kentucky or maybe even in your town. So be careful where you get your information. If you hear something that scares you, please talk to somebody about it. I also want you to know some important facts. The coronavirus is a germ, and when kids get the virus, most of the time it's no big deal. You might not really even feel sick. But adults, especially older people or people with other illnesses, can get really sick. Corona does travel from person to person, and people can catch it if they touch or come in contact with each other too closely. It can spread to many people very fast. That's why a lot of the things are happening right now. To slow down the virus and keep too many people from getting sick, our schools are closed, people are working at home, people are staying at home as much as possible. Our governor is having to make a lot of really hard decisions on what to close, but he is trying to keep us safe, and it's important. Even if you're not sick, you can slow the virus down by washing your hands frequently, sneezing into a tissue and throwing it away right away, or coughing into your elbow. You can also help by staying away from big groups of people. It's amazing to me to see everybody working together to slow down the virus. This is really important because it gives scientists and doctors more time to figure out and to take care of those people who are sick. What you are doing is truly helping other people. Another fact I want you to understand is that we don't have very many people in Kentucky who are sick right now, and that's a good thing. And we want to keep it that way. And you can help, and you are helping. One way you can do that, and I'm going to talk a little bit about this, is that you can try to stay healthy and take care of both your brain and your body. You might be wondering what you can do to stay healthy. So I have a couple suggestions for you. One is create a new routine that works for you. Routines are really important, and sometimes breaking routines is really fun. That's what we do on vacation. We break our routines. Or I remember snow days could be really fun. But in the long run, we all need routines to feel safe and secure and to not feel anxious, and it helps us feel calm. So I want you to come up with a routine. It's going to be kind of like school, where you have certain times for certain activities and certain classes during the day. I know you might be getting to sleep in a little later than usual, and that's probably okay. But the worst thing you can do is stay in bed all day. And actually, you know what I'm going to ask you to do is not stay in your pajamas all day. Sometimes we stay in our pajamas when we're sick. And that might tell our brains that we're sick, and we might actually start feeling sick. So get up, get dressed, and implement a routine and a schedule. And whatever you do, don't put too much internet surfing in your schedule. Remember what I said about bad information? And too much information will make us feel more anxious. A reasonable routine with times for breaks, for fun, and family is really important for all of us. I'd also really like you to get some fresh air. Going outside for even a short time makes people feel better, especially on sunny days. And hey, it's spring now. Take a quick walk around your block once or twice a day. That reminds me of something the governor told us the other day, that he was taking so many walks to help him with his stress that his dogs were absolutely worn out and exhausted. And he said he had to carry one of his dogs back to the house and up the stairs. Hey, you know what? That gives me an idea. If you take a lot of walks and your dog or pet gets really tired, post a picture of your tired dog from too many walks. If you can't take a picture, draw a picture of one. Let's see who can send in a picture of the most tired dog in Kentucky. If you don't have a dog, just send in a picture of something you saw during your walk. Post it to #TeamKentucky. Hey, maybe later we can get the governor to tell us the names of his dogs, and you could send them directly to one of his dogs. I also want you to find other ways to exercise. In addition to walking around the block, you can find ways to exercise in your house. There's lots of free exercise plans and routines online, or maybe someone would have to print it and bring it to you, or just do jumping jacks and push-ups at home. That can be great. Keeping your body strong will help you to stay healthy. I'm also encouraging you to help someone else. Are the grown-ups in your house seeming a little stressed? One thing that might be nice is do something for them. Maybe do a chore without having to be asked. Maybe just some kind words. And hey, if you have siblings, maybe you could teach them something, because your parents, if they're trying to work from home, might really appreciate the help with your siblings. When you help others, you really will feel much better yourself. Another bit of advice, talk about your feelings. It's normal to have some feelings of worry, but those worries might become overwhelming, and we want you to feel comfortable and find a trusted adult that you can talk to. They can help you. I also want you to know that there are people whose job it is to talk to people with worries. Hey, I told you that was one of my jobs. And maybe talking to someone will be important and helpful. If you need that kind of help, please ask about it. We all need to think about what kind of strategies we use to help keep ourselves calm. Everyone might have different ways. Some people I know take deep breaths and then slowly breathe out when they have a worry thought, and that can really help. But for you, it might be read a book, listen to music. Hey, remember what I said about taking a walk? I think the governor said taking a walk really helps him with his stress. So I want you to find some strategies that help. And finally, I just want you to know that it's normal to feel upset and that many other people are feeling the same way. We're all going to adjust together. These changes are hard. The important thing is that we work together and keep people safe by slowing the spread of this virus. You are part of Team Kentucky, and we are going to get through this together. Remember, let's send some pictures of tired pets or things you're doing on your walks and post them to #TeamKentucky. Take care.